Good evening and welcome to this virtual town hall on the City of Berkeley's response to the COVID-19 pandemic. I am your mayor, Jesse Adeguin. I'm joined tonight by the City of Berkeley Public Health Officer, Dr. Lisa Hernandez, City Manager Dee Williams-Ridley, and Dr. Lisa Varhus, the Director of the Department of Health, Housing, and Community Services. And thank you for joining us tonight to update the Berkeley community on our response to COVID-19, including on updates to recent public health orders and to answer your questions. I want to thank the many Berkeley residents who submitted questions over the last week, and we look forward to answering your questions tonight. We have heard nationally of a surge in COVID cases, and the dual impact of COVID-19 and the flu season is of great concern to all of us. And so we are continuing to respond to this public health emergency while we are working to expand access to vaccinations so that people are vaccinated and prepared for flu season. We've seen when cities and states have not taken the necessary steps to shelter in place, to require face coverings, and to not reopen safely. And we've seen a surge in cases. And so we need to continue to stay vigilant. And we're so fortunate to have dedicated city employees who are working hard to keep our community safe and to make sure that we are reopening in a way that is based on data and is not putting our community at risk. But we need to continue as a community to stay vigilant. And I want to thank the people of Berkeley for all that you've done over these past 7 months. We have a 1.3% positivity rate. And that would not have happened if it wasn't for the work of our public health officer and our entire city organization. But it wouldn't have happened if it wasn't for the work of the Berkeley community. I'm proud that in Berkeley and in the Bay Area, we took steps early to respond to this crisis. And we were one of the first regions to issue a shelter-in-place order. And that was critical in helping control the spread of COVID-19. We are making decisions based on science, and we are balancing the need to support our businesses, essential business activity, working with our schools to help them safely reopen, while also making sure that we can control the spread of COVID-19. So I know our public health officer is going to talk about modifications to the health orders that are forthcoming. We recently reopened our playgrounds. I want to take this opportunity to thank our Public Works and Parks Department for all their work to reopen playgrounds throughout the city of Berkeley so families and children can safely recreate. We are going to be allowing additional business activity under the modified health order. And we are continuing to look at the data and look at the indicators and make decisions on how to safely reopen our economy in our city. So before I turn it over to Dr. Hernandez, I just want to take this opportunity to thank her for her leadership, for keeping our community safe. And Dr. Hernandez, if you can give us an update on the number of cases in Berkeley, the modifications to the health orders that are going to be coming out soon, and any other information you'd like to share with the Berkeley community tonight.
Thank you, Mr. Mayor. First, thank you for acknowledging the work that the whole team has done. It's really been a team effort, and usually I mentioned this at the end, but I will say that having the support from city leadership and from you particularly has really contributed to the success, not only in the work that we do as a city team, but also modeling for the community as to what's important, because that's not what other jurisdictions may be experiencing. So I do want to say that it's a team effort, and it starts with everyone here on this panel tonight, I guess. But I do thank you for that acknowledgement. So I'll start with the numbers as usual. For Alameda County as a whole, Alameda has about 22,738 confirmed cases of COVID and 433 deaths. Here in the city, we're at 739 confirmed cases. That's an increase of 21 cases from our last report here at the last town hall. And we're seeing right now about an average of 1 case per day. And that's a decrease from the last time I reported to you on the numbers. We're at 1 case a day. We were at 3 cases a day at last report, so this is favorable news. In terms of number of deaths in the city, we have 9 deaths. There have been no additional increases on that, fortunately. In terms of number of tests reported on, and performed on City of Berkeley residents, we're at 67,947, and we're averaging about 854 tests per day. Again, I want to point out that's, if I can do quick math, it's about 700 more tests than we need, our target for being able to have enough tests to detect disease in the community. So we're doing really, really well on that. And I'll talk a little bit more on that. And our percent positive actually now is at 1.2%. So we're dropping every time I give a report. I'm happy to say that our percent positive, which is the amount of circulating disease in the community, seems to be going down. These case rates and our test positivity trend downward, not only for us, but for Alameda County, which is great news for our city and our county. We're also seeing the hospitalization rates continue to decline as well. So before I go into the health officer order, I do want to talk a little bit about testing. As you know, there are 2 sites that the city supports in one way or the other. One is the Optum test site, which is the test site that is furnished to us by the state. They continue to be fully booked and are providing about 140 tests per day. And their turnaround time has improved to about 3 days for a turnaround time. At one point, our turnaround was a little longer than that. So this is much, much better. The curative site is a site that we have been piloting, and that site has about an average of about 254 tests per day. There are continued opening for slots there. So I do want to encourage individuals to go to our COVID test site on our webpage to find out how to schedule a test for curative testing. And that is also open to anyone in our community. Last time I talked a little bit about flu season. Again, that is still something that is an issue. I had my traditional flu vaccine. I have it every holiday for Indigenous Peoples Holiday. I go with my family to get vaccinated. I hope people are also getting vaccinated. The Ann Chandler Public Health Clinic does have flu vaccinations on Monday and Wednesdays mornings, and a little on Wednesday afternoon, and same thing on Friday mornings. If you look at the Ann Chandler website on our city website, you can get the actual schedule, or you can call Ann Chandler at 510-981 5350 to get more information and schedule an appointment. And it is definitely an option, though we do encourage you to, if you have a medical provider, to get your vaccine with your medical provider, or go to a grocery store or pharmacy. They also have vaccination opportunities there. We also are providing pop-up flu clinics for vulnerable populations. And we've done a pop-up clinic with Good Shepherd Church last week, and we're going to do another one this week. We're also going to have a drive-through flu clinic for seniors this week as well. So again, we're focusing on certain populations that don't have typical access to health services and or are higher risk. So I just wanted to mention that. And before I talk about the health officer order, I wanted to see if Dr. Varhus wanted to give a brief update on schools, and then I'll talk about the health officer order.
Sure. Just briefly, elementary schools, transitional kindergarten through 5th grade, were allowed to open last week. I think the date was October 12th. We have had a couple of private schools begin to open their doors. I want to say that the city is providing a lot of support to the schools as they find paths to reopening. We've implemented a learning community among all of our schools, both the public and private schools in Berkeley, and we'll be convening every week to be able to answer questions, share information, share experiences, and just continuing through the school year to find a path forward to really support schools reopening safely. We do feel like at this time, given the low incidence of disease in our community and the need for young people to be able to access their education, many of them in person, that it would not be responsible for us to not try some path forward with the schools at this time. But we also believe that schools deserve the help and support around these critical health issues. And so we are working actively to put those supports in place. In addition, we have hired a new temporary deputy health officer, and one of her primary roles will really be towards supporting the schools. And so I want to assure the public that we are doing all that we can to provide that necessary support and intend to do it on an ongoing basis.
Thank you so much.
So, and I will now start talking a little bit about where we are in terms of a jurisdiction with the state tier system. As we might recall, there's a 4-tiered system from the state, with 1 being the most restrictive and 4 being the least restrictive. And we are currently in tier 3, which is the orange tier. We moved into that tier last week. And we will have to sit at that tier for 3 weeks before we can move into an additional tier if our data allows us to, in terms of being more favorable in terms of our test positivity and our case rate. So those are the 2 things that the state is using to move jurisdiction or county jurisdictions through the tiers status. So at this point, we're in the orange tier. And we will remain there. That said, we are moving through some of the sectors still within the red tier, which is the 2nd tier. And we're also considering some of the orange tier sectors to open up. And our hope is to get that order out this week with an effective date the following week. And in some of the sectors that we're looking to open, Mr. Mayor, you mentioned playgrounds that opened on Friday, which again, I will also like to acknowledge Parks and Rec and Waterfront. They did an excellent job, and they're just been a great team overall. But the playgrounds were opened on the 16th. We're hoping to allow certain sectors such as indoor worship with a certain amount of capacity, indoor dining as well, indoor movie theaters and outdoor family entertainment. And we're also hoping to expand currently allowed sectors with the expansion of retail to 50% capacity and shopping centers at 50% capacity with food courts at limited. Some other things that I know some individuals might want to know about are climbing walls and climbing rocks. Those are also things that are we're hoping to open at this point. Again, these are things that we're still continuing to watch the data, but hope to open in the next week or so. We understand that this has been a trying time for the community. I think we're all getting, if no one's tired of COVID, I'm surprised. It's definitely been something that we've all been working and dealing with, and we are trying to balance the community's desire to go back to normal with the risk of having sectors open. So I'll stop there and wait for questions, because I know there's specific questions that may come up regarding what's allowed to open and what's not. So thank you, Mr. Mayor, for the opportunity to present.
Thank you so much, Dr. Hernandez and Dr. Varhus. And I'm now going to turn the floor over to our city manager. And Madam City Manager, if you can give us an update on city operations and the city administration's response to COVID-19.
Thank you, Mr. Mayor. And again, we do appreciate you creating this platform for us to connect with community and share information around our COVID response. Again, our staff are still deployed in our EOC, working on essential services throughout the city. I do want to give a quick update and a shout out also to our park staff. As you know, Mr. Mayor, they came in, I believe, 4 a.m. as a starting time to inspect 66 playgrounds before they opened for our community, just to make sure they were safe. But in terms of how we're doing as a city and our response, this week or last week was a huge highlight for us as a city. We're looking at so many things. So we're changing how we vote. We've heightened the need for a flu shot. We're creating flu shot opportunities for folks to receive their flu vaccines. It's required us to shutter and now reopen our playgrounds, as we said, but all of that work is done by a few people within the city. It's also forced businesses to reconfigure their operations to plan for future openings as we move into these different tiers. And then as we're all working towards voting, getting a flu shot, opening up businesses, then we have to worry about dry winds and hot conditions and fire danger in our hills and red flag warnings for the hills. And so it's been a lot of issue and challenge for not only our community, but also staff in responding to all of these major things. I call it a triple threat. In terms of, we've got COVID, we've got public safety power shutoffs that have been looming, and then we have just fire and red flag warnings and the potential for fire in our community as well. So all of these events create a need for us to be as responsive as we possibly can be for this community. And I'm very proud of our EOC staff and all of our employees at the city that continue to do the work every day that usually isn't so visible. We still have folks that are out there working on electrical, working in parks, trimming trees. We have employees that are still providing emergency response services, our police, our medical, our fire. Folks are still out there working. You may not see them every day, but they're doing sometimes double jobs. As we move forward, I think our efforts around our unhoused community continue to improve. As you're aware, over the weekend, I believe on Sunday, our staff were out cleaning up the I-80 corridor. This cleanup is still continuing. We're hoping that Caltrans will honor their commitment and finish the remaining cleanup that's needed at the I-80 University overpass. The city hauled away tons and tons of garbage and debris, and I think we've made a good dent out there, but clearly there's more work that needs to be done. We are truly committed to supporting our unhoused, but it has been a challenge in terms of coordinating these efforts for cleanup with our city. But we had numerous crews out, multiple trucks, and hauling away just huge amounts of debris from that area. A core part of our work has been to find shelter for people who are unhoused and who are medically vulnerable. So as you know, and I'll reiterate, the 4 units at our house on 5th Street, it's fully occupied. We have 18 trailers and we're still filling those. We've had some turnover, but we're continuing to fill those and to make for opportunity to improve the locations of where some of those trailers are located. Both of our county-run hotels continue to be used extensively, and most of them are filled with Berkeley residents. And that's a reflection of the outreach that's led by Dr. Varhus and our staff. There are 79 people, including several that are couples that share rooms, and they're now living in 69 of those hotel rooms. There's also currently, and I believe we talked a little bit about this, but 50 nurses from Samuel Merritt who are helping to support the program participants. And I always like to just share that these are partnership efforts where it takes more than just City of Berkeley workers. It's taking lifelong, it's taking advocates, it's taking electeds, it's taking everybody to pitch in to help with these efforts. Last but not least, we continue to see active use of our expanded shower program. As you know, we have 2 showers located. One is at Willard and one is at West Campus. And Willard, every week. We're seeing over 242 clients. And at West Campus, we're seeing over 211 clients. So they're averaging good numbers per day. People really need these services, and I'm really proud of our staff for lifting these up. I'm going to turn it back over to you, Mr. Mayor, and I just want to say that, number one, I'm very proud of our organization. We have worked hard to get to the place where we are today in being prepared and responsive for our community. And the two doctors on our call today, they are rock stars. So I'm very glad that they're here to serve our community. Thank you.
Thank you so much. I just want to let the Berkeley public know that next Tuesday, at our city council meeting on October 27th, the city manager and city staff will be making a presentation on our response to the COVID pandemic. And there's a very extensive report, which is posted on the city's webpage, summarizing the multi-departmental effort to date in responding to the COVID emergency. And I just want to call attention to that and encourage Berkeley residents to tune in to learn about all the work that's been done over the past 7 months, 7+ months actually, because the EOC was activated in late January, and how employees across the entire city organization, every department, have really responded to meet this moment and to address this public health emergency. We've had staff that have been deployed to other departments doing work that they were not trained to do, but have really stepped up to serve our community. And I want to encourage everyone to tune in to learn about what we've done. I think it's made us even better prepared for other emergencies that we may face as a community. So thank you. So now to your questions. Thank you for submitting questions in a number of areas. And I want to first address these first questions to the city manager as they relate to enforcement of the public health orders. So I'm going to kind of group some of these questions. So the first question is, I have not heard any COVID enforcement measures being adopted. And then sort of a secondary question, this individual is a senior citizen living in a neighborhood where people walk by unmasked. The city council took action to give authority to levy fines. Is the city going to be implementing that ordinance?
So thank you, Mr. Mayor, and I'll attempt to answer that. So on September 15th, Council did adopt an urgency ordinance. That urgency ordinance basically allowed a means for enforcement of the facial covering wearing within our city. Any person violating the health officer's order could be subject to a civil penalty up to $100 per day. It also allowed for administrative remedy with penalties increasing for repeat violations, as well as allowing folks the opportunity to find other ways to pay that are unable to make that have to give a payment. Even with the passage of the ordinance, the focus is still primarily on large group outings. The city council was very clear that one of the primary reasons for this ordinance was to, number one, make sure that we are addressing large group events, but also number two, to make sure that we were trying to incite a way that our neighborhood services, non-police type actions could be taken. And so to date, there have been 0 citations issued, but that does not mean that tomorrow or this evening even that there would not be any citations issued. I would say that over time, we're trying to get voluntary compliance. That has always been the goal, is to not make this some type of a criminal lives effort, but to certainly make sure that people are complying so that we can keep our community safe. So at this date, we have not issued any citations here in the city. We do have the ability to do so, and we are looking very closely at those large group gatherings. What people absolutely have to do for us to help us with this is to call non-emergency after business hours when these types of activities are happening. Because during early 8 to 5, regular business hours, please call our code enforcement, and we will get someone out there. But after hours, when we hear of the most activities occurring, we need folks to call non-emergency. It doesn't mean that at that time we're going to cite everyone that's attending a group party, but we are going to make sure that they disperse. And if there are issues that are repeat offenders, then we will more than likely begin issuing citations. So that's an update that I have for you on this, but council did take action with an urgency ordinance, and we do have the ability to enforce the health officer's orders.
So during the daytime, people should call 311?
Yes, they should contact 311. Thank you, Mr. Mayor. Yes, they should contact 311, and the responding party will be our code enforcement unit. And after hours, after 5:00 p.m., they should contact non-emergency.
Which is 510-981-5900. That's 981-5900. Thank you so much.
Mr. Mayor, if you wouldn't
yes.
mind, I just want to add one additional component since I oversee our environmental health unit. Environmental health has also been supporting a lot of the foodborne industry, the restaurants, and several of our grocery stores around compliance issues, both related to in response to complaints that they may have from the community. They go in and they've been working hand in hand with many of our businesses and restaurants, and also just proactively addressing questions that come to us related to COVID and the food industry.
Thank you very much. Next sort of enforcement related question is around students living in group living settings or congregate living settings, and whether we're seeing sort of ongoing parties and risky behavior, which poses a risk of contracting or spreading COVID-19. And this would be a good opportunity maybe to update the community about the work we're doing with UC Berkeley.
Okay, so I will defer to Dr. Hernandez and Dr. Varhus to talk about their specific engagement with UC Berkeley. But I will say that what we have seen is not this huge increase of student parties and activities off campus. And that's not really happening, but we are ready to respond to those events when they do occur. And we encourage people to call 311 and or 911 if they're seeing large parties. We haven't had a huge number of reports of large party gathering for college campuses or off-campus environments. So Dr. Hernandez, if the two of you would like to speak to the detailed work that you all are doing with the with UC around our health orders and also around working with them on disease containment.
And before Dr. Hernandez addresses that, if you see a large gathering, we do encourage you to call the non-emergency number 981-5900. I know a lot of work's been done with UC Berkeley to educate students around the need to comply with public health orders. UC Berkeley has modified their student code of conduct to state clearly that violation of the health order is a violation of the student code of conduct. We haven't seen a huge spike as a result of parties and other activities. But we do have tools available, not just the ordinance that we passed, but our second response ordinance, which is another tool our police have.
So I'll speak a bit about what we continue to do with UC Berkeley, specifically University Health Services. They have always been an amazing partner with the city, specifically public health, and definitely communicable disease unit, which is now the disease containment branch for this response. We work with them with cases and contact tracing. They're actually trained by us, and they are performing the case interviewing and the contact tracing for any UC Berkeley student. And we work together and meet with them multiple times a week. Actually, we have a standing meeting twice a week for the clinical staff to meet on the public health side as well as on the university health services side. And then I meet weekly with the medical director of university health services, as well as one of the vice chancellors who is over health services. And we talk about what we're seeing in the community, we're seeing in the university community in terms of cases, and we brainstorm any sort of activities, additional activities that we need to do. And just as both Madam City Manager and Mr. Mayor mentioned, we have not seen increased cases after the most recent holidays, which is great. And it seems the communications that we've had with some of the congregate living facilities, fraternity houses, co-ops, student housing has really helped with curbing activities with parties, which is excellent. And we continue to work with them at looking at how we would move forward with any additional activities on campus, whether it's bringing certain sectors back or not. At this point, we're actually allowed to have in-person classes indoors at the university, but we're not currently allowing that. But we are looking at ways to pilot some in-person instruction in the future. That said, the university continues to test their students weekly, routinely, and whenever a student has concerns about exposure or symptoms, they can come in and get tested same day. And I'll stop there unless, I don't know if Dr. Barhus has any additional things to add.
I just want to add that I think that largely when you hear about universities across the country and a lot of the problems and challenges they've had with multiple partying, that's nonstop. I mean, we're talking about young people who have a natural tendency to want to do things differently. I think largely we should really be proud of UC Berkeley that for the very large part has managed to contain the disease, and they have worked to deal with some of the off-campus living. But I think we need to be careful not to conflate the national narrative with what UC Berkeley is actually really trying to accomplish. They are truly good partners in this endeavor.
Thank you very much. The last question is around travel restrictions. This resident asked, can Berkeley restrict travel from visitors into the city? How can we require quarantining for out-of-town guests? They express concern about the holidays and people visiting Berkeley during the holiday season.
So, and clearly holidays are when families get together, and we encourage those bubbles to continue. It's hard, especially for our seniors and families that need to reach out to one another. This is really challenging. Berkeley isn't an international hub. It is, but it's not. Our UC, our university, creates that hub where we see a lot of students coming in from different places and a lot of parents coming in to visit. But if you were to say that were we a New York or a San Francisco or Los Angeles hub where you see the influx of international travel to where you would want to place a restriction of that nature, again, we're surrounded by multiple jurisdictions. So we're 2 miles away from Oakland and another mile away from Emeryville. So our borders are such that we have a lot of movement between not only our city workers, but how we live and play and the types of services that we seek. So containing an environment such as travel from family members coming into our city would be very, very difficult. I do believe that at places like airports and big international environments where you've had to see that type of or level of intervention, that would be probable for some jurisdictions, but not Berkeley. Again, our borders are like an amoeba. We have, folks move around considerably. So while we're not entertaining that, what we are doing is we're staying very cautious about how we move through this tier, through this orange tier of resources within the city, and how we are making sure that not only the employees of the city are adhering to the restrictions and they're out there moving about and serving our community, but we want to make sure that our community, our employees, and our visitors understand the importance of wearing a mask, understand the importance of observing the 6-foot guidelines, and making sure that we do those things. Those are the things that are going to keep us much more safe than restricting maybe a few flights or a few folks into our city to visit our family members. So again, I welcome my family coming to visit, but they have to come with the fact that you need to get tested, you need to wear a mask, and you need to be 6 foot apart from me as much as possible. So not to make light of this, I just want to say that it's not something that we could pursue here in our city, but thank you.
Thank you very much. Okay, I'd like to direct the next set of questions to Dr. Hernandez. And the first one is around the curative test. The question was, who pays the curative test when someone does not have an insurance bill? Does the city incur the cost? Is there a way to encourage residents to consistently use their insurance as payment for the test?
Dr. Hernandez, should I answer that question since I work with the curative directly? Curative will test anybody that comes regardless of insurance. They will bill insurance, and we are relying on people that are insured. Berkeley has a relatively high percent of its population insured, but not everybody's insured. So we encourage everybody to share their insurance information so that we can continue to offer testing to anybody and everyone, because that helps to support the uninsured. And then the CARES Act actually does provide for, allows for some reimbursement of test costs even to folks who are uninsured. And so they're working on those channels to support the ongoing testing. And that is what is allowing us to test so many people in Berkeley, is by relying on insurance, we can make testing available to anybody who needs a test. And that includes essential workers who may need testing on a regular basis.
Okay, thank you very much. So on to the next question around herd immunity. The question was if you can please explain the theory behind herd immunity. That's not to necessarily say that herd immunity is a good solution to protecting our community from COVID-19, but the question is just around the theory behind herd immunity.
I'll take that one. So herd immunity occurs when a high percentage of a community is immune to a certain disease. And that can happen in two ways. One is through a vaccination, or through natural means by having prior illness of that, whatever illness it would happen to be. And what happens is that essentially the entire community is protected from that infection because of the general high number of individuals that have either been vaccinated or been immune because they've been exposed to the disease from illness. And that protects people that haven't been vaccinated or had the disease, such as newborns or immunocompromised individuals that may not be able to get vaccinated because of their immune status or their age. So they're getting some level of protection because the rest of the community is protected because of either being vaccinated or having the illness. And we know, as you mentioned, Mr. Mayor, using the concept of herd immunity may not be a good idea in certain situations. For example, for COVID, because we're not sure how long immunity lasts with this illness. At this point, we know that there's an immune response, but we're not sure how efficient that immune response is to protecting you or others around you from the disease. So that's one thing. And we are still learning more and more about the impacts of the actual infection on individuals. So we know that that there's going to be known impacts to getting sick. Some people, we know people are dying. Some people are getting sick enough to be hospitalized and having residual disease that causes problems in their lungs or with their level of energy or pain. So we know that there's going to be unnecessary infections and suffering and death. What we also are learning is that it will take up to 50 to 70% of the population to be immune to reach herd immunity for COVID. That's what we know today. That might change tomorrow because we're learning about this disease more and more. And right now we're seeing about less than 10 or 15% of the population in the United States being exposed to COVID. So that's a long way to go for achieving herd immunity that will have more cost to our community than benefits. So that was a long response to that question, but hopefully it was helpful.
Yeah, absolutely. Thank you so much. Sort of a follow-up question to what the city manager had addressed. As we're going to be approaching Halloween, if we could talk about Halloween a little bit, and what do we advise that people do? How can people safely celebrate Halloween? And also, as we're approaching the Thanksgiving season, what are some recommendations for how to safely celebrate these holidays, and specifically how to celebrate holidays with your family?
Well, I have to change my plans. I guess I'm not going to the city manager's house for Thanksgiving this year. Just kidding. But honestly, I really do like what the city manager said in terms of your bubble. Well, that's a concept that we've allowed for months now in terms of our having a social bubble where we know that individuals need to see each other. And but we need to do that safely. So if we apply that social bubble idea to whether it's Halloween or Thanksgiving, that's one of the ways that we can actually enjoy each other's company during those special times of the holiday, whether it's Halloween or Thanksgiving or any of the other holidays coming up. Big things to think about: smaller is better. Outside is safer, and that's what's restricted to is outside gatherings, and having a stable group that you have interacted with safely for within the last 3 weeks, and really would encourage social or physical distancing and wearing face coverings at all times during that time. So that's one way to celebrate the holidays. There will be more guidance coming out from the state and from us, hopefully, about Thanksgiving holidays. In terms of Halloween, of course, the door-to-door trick-or-treating is not something that we advise at all because of the risk of interacting with individuals that you don't normally interact with, and also gathering, I remember my Halloween days, and we trick-or-treated, and there was a bunch of us just going, we would pick up kids along the way, and that's not what's happening here. We cannot have that because we know that that's going to be exposures that will put our children at risk and our families at risk here in our community. So I'll stop there. Hopefully that answered the question.
Yes, thank you so much. And I believe the city had sent out an email with sort of advice and guidance on how to safely celebrate Halloween, and that information is also posted on our city website. So some of the traditional events like the Russell Street Halloween celebration will not be happening this year, but there are ways for people to safely celebrate within their social pods. Thank you. Question around indoor dining. This is, I think, really expressing an opinion, but this resident is expressing concern around allowing limited indoor dining. And this resident believes that this is reckless. People without masks in close proximity, eating indoors, drinking and talking may result in an increase in COVID-19 cases. Why can't we wait until COVID is over? Dr. Hannah, I don't know if you have any thoughts just on what went into the decision to allow limited indoor dining.
I'll say first, our numbers are the best that they've looked since the beginning of the COVID pandemic in terms of our case rate and our test positivity in the community. I know that it will change as we open more and more sectors, and that is why we're opening gradually. Alameda County and City of Berkeley are moving slower than what is allowed by the state. That's for a reason. That's what we've been doing since the beginning. And we will continue to move gradually because we don't want to increase the impact of transmission with these additional settings opening up. That said, the restrictions for restaurants are pretty, they're pretty well outlined in our guidance and the state's guidance. People will have to physically distance. So there's at least 6 feet between tables. Individuals are required to wear their face coverings unless they're putting fork to mouth or glass to lips. So as soon as you're done with that, you put your face coverings on. So those restrictions will continue to be enforced in those settings, and we are balancing again, allowing people to partake in certain activities as well as having those restrictions to protect people as best as we can. And it's an individual choice for whether or not you want to go to a restaurant indoors or not. So that's another thing I want to highlight as well.
And we still do allow outdoor dining. And so there are a number of restaurants in Berkeley that have gotten permits to convert parking spaces into parklets. And so that remains a safer option for people. As we know, being outdoors is certainly safer than being indoors. And we also encourage people to pick up food for or to bring home or for delivery if you don't want to actually patronize a restaurant. So there are many ways you can support our local businesses and restaurants without actually being inside the actual restaurant itself. Okay, next question is around what this individual is referring to as medical interventions. I'm assuming they mean therapeutics, and have medical interventions or therapeutics improve the chance of a better outcome if one contracts COVID-19? Have the odds improved? If so, by how much? I know that there's not a lot of therapeutics out there yet widely available on the market, but there are some.
Yeah, they're still investigational, though some of the medications, the antivirals, are available in hospital settings. There's additional testing and studies that are being performed on outcomes for individuals who are using that medication. So at this point, there isn't a cure or a specific medication that we can for sure say is the best treatment, and they're still under investigation. What I would say is that if someone is high risk for getting COVID or has risk factors for having a more severe case of COVID based on age or health conditions, that they should have a plan now.
Yeah.
What to do, ask their provider what to do if they're at higher risk, and seek medical care soon. Because that's one thing we know is individuals that are able to seek care soon do better. And have access to some of the supporting measures such as hydration, oxygen, and some other supports that can be provided potentially in a clinical or potentially in a hospital setting. So that's one thing I would say that we can all do now that we do know is helpful, is being able to be able to have that conversation with a medical provider and having a plan.
Thank you. Okay, next question. if you can address sort of outdoor performances and indoor performances and live streaming. This resident asked if you could explain why music venues cannot have live music outside for a limited size audience, and whether or when they will be permitted. I know sort of another issue we've heard about, and we've received a number of emails about our performances indoors and live streaming of those performances. If there's a limited number of people who are involved in the production, and so Dr. Hernandez or Madam City Manager, could you maybe sort of address the sort of outdoor performance and indoor performance issue? I know I've gotten a lot of questions and emails about that recently.
So Dr. Hernandez, you can go ahead. I know you've been working very hard with Alameda County and our other partners in looking at options and opportunities for us to at least look at movement toward allowing for indoor live streaming, but I will yield.
Great. I'll say this: we understand the challenges our community is experiencing without having these live performances that we all miss. I would love to have live music right now if I could. And we are exploring the current state guidance as well as guidelines from other jurisdictions to see what the path forward would be here in the city, especially with some of the live streaming opportunities indoors. As most of us may know, outdoor live streaming is already permitted, and there's a robust guidance for that on our web already within our order. So we're looking at that guidance and seeing if we can modify that to allow indoor live streaming without audiences. And then we're also looking at outdoor performances with an audience. So I will say all of these activities are not without risk, especially singing. Singing has been proven to be higher risk because of the fact that we're projecting our voice, and we're able to also project droplets and aerosolize some of the viruses more efficiently that way. So it is not without risk. So we're again looking at how we can provide certain opportunities in the community, both to be safe as well as compliant with current allowances from the state.
Thank you very much. Next question is around a second wave. Do we expect that the second wave will be worse than the first wave? We know that we've seen a second wave throughout the country, and I know there's a concern about second wave in California. Are we seeing a second wave in Berkeley? Do we expect there will be one?
We're not seeing one at this point. As I mentioned earlier, we're doing quite well in terms of our disease transmission. And a lot of it has to do with the fact that the community has been complying with the social distancing guidelines or physical distancing guidelines and continuing to wear face coverings. What I would say, what I'm worried about is flu season. And that's why I'll remind people to continue to get vaccinated because you'll have a 1-2 punch with the flu and COVID. You may actually increase your risk for getting COVID if you're also battling a flu. So that's one thing. I hope that we don't have a second wave in the region or in Berkeley, and we're watching that day by day. But at this point, we're not seeing it, which is great, and I'm crossing my fingers, but I'm also relying on the community for continuing to follow the restrictions of physical distancing and wearing your face coverings, and really still limiting your activities. It's sort of a risk-based. You have to decide what you're going to do, and maybe reduce one activity so that you can do another, so you're not exposing yourself over and over, and to other individuals that you don't normally see.
And I would just like to add one additional factor, and that is we're all looking toward how well we can remain within the guidelines during the holidays. Almost after just about every holiday, we have seen a spike or a surge. It's generally been moderate, but we're both about to celebrate both the Thanksgiving holiday, which is the biggest holiday of the year with a lot of travel, and then the December holiday season overall, which is also highly celebrated. And at the same time, by nature of our weather, that's when we will start pulling inside. So I just wanted to put in an additional plug for all of us continuing to be mindful and watchful, because we will move into a higher risk area from a behavioral standpoint.
Can I add one other thing? You just reminded me, Dr. Varhus, about when we are gathering with individuals, hopefully safely, that we also ask certain questions to those people that we're gathering with. One is, are you sick? Have you been sick? Have you been exposed to someone who might have had COVID or has COVID? And the other thing, which I think is just as important, is like, what are you doing to protect yourself? Because I might have standards that I think my friends have that are aligned with mine, but they may not be. So making sure that you're aligned with the families or the individuals that you're gathering with, to assure that they have the same standards of protecting themselves, and that you're not exposing yourselves to undue risk. So that's the other thing that I think is really important. Just because you get along or eat the same types of foods or whatever, you may have different practices in terms of how you protect yourself and your family. And that's a really important question to ask during these times as well.
Thank you very much. Sort of last question, although this is also kind of a statement. This question is sort of asserting that the shelter-in-place order has worsened public health, and respectfully, I would disagree. I think had we not done that, we would have seen more people who would have contracted COVID-19, and we've had more deaths. So certainly, the shelter-in-place order has had an emotional toll on all of us. There's no question. People having to shelter in place, people working remotely, parents supporting their children in distance learning, the economic impacts people have experienced, people losing their jobs, family members who've contracted COVID-19. It's been challenging for everyone, and sadly, we've had 9 people who've died in our community. So I do want to just acknowledge that while this was really critical to control the spread of COVID-19, and to make sure that more people don't contract it or spread it, it's had a real impact on all of us. And it's definitely had an emotional toll on all of us. Dr. Hannes, I don't know if there's anything else you'd like to add on that.
I'll let Dr. Varhus answer, because I know she...
So I'm a fake doctor on the call. I'm actually a psychologist, not an MD. And so I do want to speak to that just a little bit. And that is that there is no doubt that the mental health of our community has struggled. The mental health across the world is struggling right now. And as these second waves are coming through in some places, it's even more, it's even more difficult. I can say what we haven't seen is in Berkeley is overrun hospitals. What we haven't seen is, high levels of infection or higher levels of death. And sometimes, when we're in a difficult, challenging situation, we forget to look at that our outcomes are actually quite good because of all of this challenging work we have done. And if we hadn't done this work, then I think we would be far more suffering from more grief and loss than has already been experienced. So I want to name that. And then I also want to name that the city's, all of our public health and mental health services transitioned extremely quickly right away to a telehealth model, where we're continuing to provide mental health supports to the most vulnerable, continuing to provide access to public health services and supports. And our aging services division in particular has, quadrupled the number of meals they're delivering, continue to provide case management services, reached out to our senior population, and they're even co-sponsoring a flu clinic for seniors specifically on Wednesday this week. And so we are also trying to address a lot of the emotional challenges that we're all experiencing, and we can continue to do more of that. And I do believe that we also should be continuing to think about the prevention and support through these difficult times.
Thank you so much. I'd like to take the last set of questions. There was a question around how does COVID fit into council priorities? I will say that it is our highest priority, and it's been the highest priority of the entire city organization, but we've also had to manage other challenges at the same time. And also the impact of COVID on sort of exacerbating current challenges like homelessness and housing insecurity and unemployment and the impact on our tax base and our businesses. And there's no question that the impact of COVID isn't just a public health impact. It's had an emotional impact. It's had an economic impact. It's impacted every aspect of our community. We see businesses that are closing, and businesses that are struggling to stay open. And so our focus has been, how do we support the health and well-being of the entire community? Not just by providing emergency assistance for small businesses, rental assistance for people who are facing housing insecurity and unable to pay their rent, or eviction moratoria that protects commercial and residential tenants from eviction. But we're also focused on many other longstanding challenges in our city, addressing homelessness, our housing affordability crisis, the threat of wildfires and climate change. And there's no question that we've experienced that firsthand with orange skies and ash and poor air quality. And so we thought these past 7 months have been managing multiple challenges, multiple crises simultaneously, but I've been deeply appreciative of how our city leaders have stepped up to address all these issues with the focus on the health and safety of our community, because that is our focus, health and safety. So COVID has and will remain our highest priority, and balancing all these other issues has been admittedly challenging. And that means that certain priorities and certain projects that we had intended to move forward this year are on the back burner. And that means we have to make difficult decisions around balancing our budget. We're not done. In November, we're going to have to consider further amendments to our budget and how to accommodate additional needs, including addressing the fiscal impacts of COVID-19 on city operations and our city budget. So we know that we have challenging days ahead, but we can look back and be proud of what we've been able to accomplish, the 1.3% positivity rate, despite being the home of the University of California campus. I think we've done a good job of managing this pandemic, and this will continue to be our highest priority, but dealing with the impacts, all the impacts that COVID has wrought on our community. There was a question around the eviction moratorium, and this resident had asked whether that legislation expires on November 21st, and our eviction moratorium, which is actually Berkeley Municipal Code Chapter 13.110, is in effect throughout the duration of the local state of emergency. So the local state of emergency is still in effect, and council every 6 months does ratify the extension of that local emergency. The local emergency has been in effect since March 3rd. And given the threat of COVID-19, our community, I imagine, will be in effect for for many more weeks or months to come. So that legislation is still in effect. It prohibits most evictions in Berkeley. And I would encourage people to go to the Berkeley Rent Board website, cityofberkeley.info/rent, which has information on our eviction moratorium, as well as how to access resources, including financial assistance if you need help paying your rent. And so the eviction moratorium is still in effect. It will be in effect during the duration of the local emergency. So we are providing at least that essential protection so people cannot be evicted for their inability to pay rent. And the law actually prohibits eviction even after the local emergency is lifted for rent debt. So say you owe six months rent and you're not able to pay that, you can't be evicted for that rent debt, even after the lifting of the local emergency. The state did pass legislation to also extend certain protections until February 1st. And there are new state requirements that do require that you have to pay a portion of your rent. And so once again, we encourage people to go to the Berkeley Rent Board website, cityofberkeley.info/rent for more information on the new state legislation and our local eviction moratorium. Lastly, our last question is around what the city is doing around closing streets for outdoor dining, retail, and entertainment. We did launch in June a permit program. The council passed legislation, our staff moved quickly, and I want to thank our planning department and Office of Economic Development for putting in place a permit system to grant over-the-counter permits. You can apply online, and this will allow the use of sidewalk space or parking spaces for parklets for outdoor seating. And so that permit program is in effect. We've seen a lot of restaurants who've taken advantage of it. It's an over-the-counter permit. We're looking at other ways to support our small businesses through additional grants and looking at whether there's additional closures of streets to expand space for outdoor business activity. So stay tuned for that. But currently, we do have a program in place. We also do have the Shared Streets program, where we've closed several miles of streets in Berkeley to allow people to safely bike and walk with physical distancing. So these are all programs that are still in effect, and hopefully we can continue to expand. And I think we actually have, legislation coming to the council to look at whether to make some of those the parklets and partial closures permanent, even after this pandemic. So we'll be discussing whether to make this parklet shared streets program permanent. We did receive several questions around the university's long-range development plan, and I will respond to those questions directly to that constituent. I want to acknowledge that tomorrow evening at 6 o'clock, the City Council will have a work session in which UC Berkeley will be presenting on the long-range development plan. And so that's a great opportunity to hear about the university's plans for future growth in the city of Berkeley, and to offer your comments on that as well. So go to the City Council webpage to access the Zoom link and the agenda, and we encourage your participation. So those are all the questions for tonight. I want to thank our panelists for participating, and before I turn it over to Dr. Hernandez to offer parting comments, once again, we're seeing a second wave throughout the country. But in Berkeley, because of the work that we've done over the past 7 months, we've been able to effectively control the spread of COVID-19. Now is not the time to let up. We need to continue to stay vigilant. We need to continue to follow our public health orders, to practice physical distancing, to wear your face covering when you're outside, to shelter in place. This is really essential to control the spread of COVID-19. And lastly, I just want to encourage everyone, and I'm going to use a prop, to vote. Please vote. Please vote early. This is essential for the future of our city and our country. We had provided information previously on ballot drop boxes. There are ballot drop boxes in front of 2180 Milvia Street, our City Hall in downtown Berkeley. We have a ballot drop box on the UC Berkeley campus in Sproul Plaza, and ballot drop boxes at all of our libraries, our city libraries, the North Branch, the Claremont Branch, and the West Branch. And so that provides a safe way for you to drop off your vote by mail ballot. Everyone has hopefully received a vote by mail ballot. And so that's a safe and secure way to participate in this election. We know that there are serious concerns around voter security. We've seen in some cities and counties people setting up unauthorized vote drop boxes. These are official drop boxes. They are the registrar of voters comes and collects the ballots. So that's one way to vote. You can also mail your ballot. And we have 9 accessible voting locations throughout the city of Berkeley, including at the Ed Roberts campus and other city facilities. So if you go to the city's webpage, cityberkeley.info, as well as to the Alameda County Registrar of Voters, acvote.org, you can access a list of all the accessible voting locations. You can vote that weekend or even on election day. And so if you want to go to the polls and vote in person, you're certainly able to do that safely. But please vote. Please exercise your right, have your voice be heard. There's never been a more important election in the history of our country. And how we are able to effectively control the spread of COVID-19 depends on who we elect and depends on how we respond. And I will just say that the lack of a national comprehensive plan for addressing COVID-19 has resulted in over 230,000 people dying in this country, one of the worst rates of responding to COVID-19. So please vote. It is more important now more than ever to protect the safety of yourself, your family, your community, and to help our country get out of this pandemic. So that's my public service announcement for today. Please vote early. And I want to turn it over to Dr. Hernandez. If she has any closing comments now.
Well, I will stick to the thank yous. And I want one of those face coverings, though. That's very nice. I really do like it. It solves 2 problems. One is, controlling disease and reminding people to exercise their civic duty. But I will say thank you again to you, Mr. Mayor, for having this town hall. It's a great opportunity to be on a panel with these esteemed panelists, as well as communicate and have a forum with the community, and to hopefully answer any questions that individuals have. So I do appreciate that. And I do want to remind people to continue doing the good work that they're doing with using their face coverings and physically distancing, and also thinking about how to stay safe as we move through this time. And also, again, I'll remind individuals to get vaccinated for flu as soon as they can, because that also is going to help people stay safe. Thank you again, and I'll hand it back to you, Mr. Mayor.
Thank you so much, Dr. Varhus. Any closing comments for the Berkeley community this evening?
I just want to thank you as well, Mr. Mayor, and your staff. I actually didn't get to say that in the introductions. I think having these town halls are really helpful and informative to the community, who I know is just really wanting and seeking information. I also want to just say to all of our businesses and out there that we hear you. We are working to support you. We are building a strong COVID unit to support as we reopen. And so if we can all just hang in there and stay vigilant, we can continue to make progress as a community and can perhaps see a wonderful spring ahead of us.
Thank you so much. Madam City Manager, any closing comments to the Berkeley community this evening?
Thank you, Mr. Mayor, and thank you to the entire Berkeley community. We, as you can see, my daughter's trying to hide in the background there. She's not doing a good job. But thank you so much for trusting us as your leaders in the community. It's been tough and challenging, and you've held on with us and you've continued, and we are seeing great results. I do think it's important as we move into the holiday seasons that we continue, as Dr. Varhus and Dr. Hernandez, even the mayor has said, to really be vigilant and really be careful out there. Know that we are still working behind the scenes very hard for all of you. And in closing, I'd just like to thank my entire staff, the entire organization at the City of Berkeley. The employees that you have serving you as a community are amazing. They are working very hard. They are risking, as well as all of us are risking, as we're living and working every day. And so I just want to thank those workers that have been on the front line since the beginning of this pandemic, and they continue out there. So hats off to all of them. And thank you, Mr. Mayor, for getting us all together again. Thank you very much.
Thank you. And once again, next Tuesday at our regular meeting at 6 o'clock, actually the bulk of our meeting will be receiving a presentation from our city team on our response to the COVID emergency to date. There's a really excellent report that's on the city's webpage. I would encourage everyone to read it. And I think it really does a good job of really explaining how every aspect of the city organization came together quickly in really facing an unprecedented crisis, and moved really quickly to implement a variety of different programs, not just our public health response, but how we support our businesses, our housing programs, childcare, the work we're doing with our schools, our collaboration with UC Berkeley. It has really been all hands on deck, every aspect of our city organization. And I think we should be proud of what we've accomplished. We have been able to successfully control the spread of this virus. It still is an incredible threat that we need to be mindful of and need to continue to protect ourselves and our community from. But I want to encourage everyone to mask on to move on. Remember to wear your face covering when you're outside. It will help us move on past this pandemic. Please continue to follow the public health orders. It's essential to control the spread of this virus. But our early action to shelter in place, and the incredible work of our health officer, our city manager, our HHCS director, and all of our staff have really made a difference and have protected our community. And we need to continue to stay vigilant. So please be safe, everyone. Please remember to wear your face covering when you're outside. Remember to practice physical distancing, to shelter in place to the extent you can. Please be safe. Thank you to our city leaders for joining us tonight, and we'll see you at our next town hall.